Good evening, I am Dr. Deepak Patkar. I head the imaging department of Nanavati Super Speciality Hospital and I am also the medical director of this institution. Football, as we all know, is by far the most popular sports in the world. As far as India is concerned, it is also catching up very fast. The next generation prefers football over cricket by far the most, and we are happy to be associated with activity of football in the country. If you look at injuries which happen with football, they are broadly divided into acute ones while playing sport and chronic ones which happen due to chronic overusage of muscles and bones. Dr. Doshi spoke about acute and chronic football injuries. Radiology, whether it is X-ray, CT scan, ultrasound or MRI, forms kind of eye of the orthopedician. Before treating these conditions, they would definitely like to know how bad the injury is or how minor the injury is. Also, quantification of damage to the cartilage, damage to muscles can be assessed very accurately using imaging. Whether it is a very benign injury like you have strains and sprains versus career-threatening ligamentous injuries, imaging plays a vital role, and the outcome of imaging many times decides the outcome of the disease. If we look at the lower limb injuries, it can be ankle strains, sprains, you can have ligament injuries of the ankle. In the knee, you can have meniscal tears, you can have ligamentous tears. All these things can be detected very accurately using MRI. You can actually quantify how bad the damage is and whether the patient or the football player requires surgical intervention or rest can be ascertained using this. In very acute situation, when the patient or the football player is on the field, a portable X-ray can be useful. It will allow you to look at fractures. Subtle marrow edema, marrow contusions may not be seen on X-ray, but if the patient requires to be taken off from the field, can be decided on X-ray. A lot of people world across use portable ultrasound to look at muscle injuries. When patient comes to hospital, it would be important to differentiate ligamentous injuries, bone injuries in terms of severity, and for that CT and MRI are very useful. CT scan is used to look at fractures. MRI is used to look at soft tissue injuries. So muscle tears, strains, sprains, meniscal injuries can be ascertained very accurately. All in all, the outcome of the injury of the footballer can be assessed accurately using imaging, and that will allow the sports medicine specialist to decide what line of treatment is important and appropriate for the given patient.